Hello, my name is Kweku. I am a pharmacist, and in this video I want to highlight 6 possible warning signs that you're not getting enough vitamin D and how it can affect your health. Also, stick to the end as I will share with you 3 categories of people that are most likely to be vitamin D deficient. Now, the first warning sign I have on my list is bone pain and muscle weakness. The body uses vitamin D for normal bone development and maintenance by increasing the absorption of calcium, magnesium, and phosphate. Now, if you don't get enough, it results in a condition called osteomalacia, which involves softening of the bones. Now, as osteomalacia progresses, you might develop bone pain and muscle weakness. This tends to be a dull, aching pain, mostly affecting the lower back, the pelvis, the hips, the legs, and sometimes the ribs. This pain for some people might be worse at night or when you put pressure on the bones. In one study to assess the relationship between vitamin D deficiency and pain severity in patients with low back pain, it was concluded that deficiency of vitamin D was associated with bone and muscle pain. It was also determined that the severity of the pain increased in patients with low back pain as the deficiency of the vitamin D increased. In other words, the lower the vitamin D levels, the greater the pain. So for this reason, it is highly recommended to have your levels of vitamin D evaluated by your doctor if you suffer from bone and muscle pain. Number 2, mood changes or depression. Now, it has also been suggested by several recent studies that there is a direct correlation between low levels of vitamin D and depression. Now, although the evidence is not entirely conclusive, one review which analyzed 61 articles concluded that there is definitely a relationship between vitamin D and depression. Clinical depression is seen to be inversely correlated with serum vitamin D levels. In other words, the lower the serum levels of vitamin D, the greater the incidences of clinical depression. Now, it's worth noting though that the researchers stated that the evidence is not conclusive enough to just start blanket recommending universal supplementation of vitamin D for depression. In other words, they are not saying that the moment you are diagnosed with depression, head straight to your local pharmacy, get some vitamin D pills, and everything will be fine. No, that is not what they are saying. Sometimes in statistics, two things may be correlated. They may move, head to head together, but one may not necessarily be the cause of the other. That is why these researchers are just, cautioning that vitamin D is not a cure for depression. On the other hand, another study involving 948 participants found that supplementation with vitamin D improved the depressive symptoms of the participants. So while vitamin D is not a cure for depression, it is definitely worth exploring if you suffer from depression. Number 3 is slow wound healing. Do you have a wound, especially after a surgical procedure that is taking forever to heal? Might not be a bad idea to consider checking your vitamin D levels, or better still, increasing your dietary consumption of vitamin D. Now, if I can use this analogy here, so think of your skin as a brick wall, okay? When there is a brick or a hole, which is the wound, you need more bricks, skin cells, to repair it. Vitamin D helps your body produce more of these bricks quickly. Now, this is what we call cell proliferation, making more skin cells to fill in the gap. If you don't have enough vitamin D, then this process is compromised, resulting in slower wound healing. Now, in one study, it was observed that people who were vitamin D deficient had high levels of certain inflammatory chemicals called cytokines, which tend to have a negative impact on infection and the healing process. Number 4, fatigue and tiredness. Admittedly, feeling tired and fatigued can be due to a whole lot of factors, including deficiencies in other vitamins such as B12. However, it is very well documented that low levels of vitamin D can also be a contributory factor. In one study involving 200 nurses from Iran conducted in 2013, researchers were able to associate the high prevalence of fatigue among nurses with a deficiency of vitamin D. The next one is being sick often. Now, this is directly related to the role vitamin D plays in supporting the immune system to help your body fight off infections caused by viruses and bacteria. Vitamin D is essential for the activation and proper functioning of what we call T cells, which are a type of white blood cell that plays a central role in the immune response. Without enough vitamin D, these cells can't be activated effectively, which is crucial in their response to pathogens or agents that cause sicknesses. So if you often become sick, especially with colds or the flu, low levels of vitamin D may be a contributing factor. There is evidence to suggest that vitamin D replacement may reduce the risk of acute respiratory tract infections in people with a deficiency or insufficiency. Number 6, bone loss or osteoporosis. Now, in many cases, especially among elderly people, the first recommendation when they're diagnosed with osteoporosis is, hey, take a calcium supplement. However, it is often overlooked that vitamin D is necessary for the optimal absorption of calcium and is therefore a key ingredient in the battle against bone loss and osteoporosis. According to the National Osteoporosis Foundation, this is particularly important for women after menopause. Now, studies have also found a strong correlation between low levels of vitamin D and low bone mineral density. So if your doctor recommends you taking calcium, if you're diagnosed with osteoporosis, ask the doctor if vitamin D may also help. And another vitamin, vitamin K2, which I have a video of it coming up soon. So look out for a video on the relationship between vitamin D and K2 and calcium and osteoporosis in that grand scheme of things. Now let's talk about the 3 categories of people who I mentioned are slightly at a slightly more elevated risk of having a vitamin D deficiency. The first group of people are older people. Now it's important to keep in mind that as we age, our skin's ability to produce vitamin D decreases. This means that if you're over 65, you may be at a slightly elevated risk of vitamin D deficiency. The second group of people are people with dark colored skin. Now, for people that look like myself with dark skin, it is more difficult to make vitamin D from sunlight than, say, light-colored skin people. So people with darker skin are at a slightly elevated risk for vitamin D deficiency. The third group of people are homebound people. Now, people in nursing homes and other facilities or people who are homebound or rarely go outside are at a higher risk for vitamin D deficiency just because, they cannot use the sun's exposure as a source of vitamin D. They are indoors most of the time. They don't get the benefit of making vitamin D through exposure to the sun. Now, granted, while vitamin D may not be responsible for all these symptoms, it is crucial to be vigilant about vitamin D deficiency in any individual who displays any of these symptoms, particularly since vitamin D levels in the blood can be relatively easily measured. I sure do hope you found some value in this video. If you did, give it a thumbs up, and on your screen now is another video that I think you may find interesting. Stay blessed and catch you on the next video.